Hi, I'm Dr. Ashish Dutta. I'm a cosmetic surgeon and I work at the Aesthetic Beauty Center. Blepharoplasty is an operation which is performed either under local anesthetic or under local anesthetic with sedation to help make the eyelids look fresher and younger. Blepharoplasty is an operation that is performed on the eyelids. There are various factors which add to the aging process. The laxity of the skin, which appears as wrinkles, or sometimes even the laxity of the skin around the eye. The fat, which is quite often protruding and gives the appearance of eye bags, or sometimes the fat will atrophy, that means the fat will shrink, and that gives the gaunty or the tired looking appearance. If there is any ligamentous laxity, that appears as the drooping of the eyelids or sometimes the drooping of the corners. All these need to be taken into account into planning the operation for the patient, and hopefully we'll be able to make the patient look fresher and less tired. The advantages of blepharoplasty is it is a minimally invasive procedure in the sense that it is performed as a day case. The patient can go home after the operation, and not only that, with very little tightening, the effect that it does for the patient helps the patient look fresher and younger. The recovery from blepharoplasty is dependent on the individual patient's, of course, healing and other factors, but usually a patient can go back to their normal social activities and work within 7 to 10 days. As it happens, ladies recover quicker because they can apply makeup and hide some of the bruises that you can get from blepharoplasty. Some of the other side effects, of course, apart from bruising and swelling, are scarring. We try to hide the scar under the eyelashes as close to the eyelid margin as possible, but still then they can be visible for up to 3 to 4 weeks, sometimes even longer. But people are worried about that other people will notice them. What I try to explain to people is that it is helping you look fresher, not necessarily younger as people would always want to, but the other side effect that you also need to take into account are hematoma, that means collection of blood under the skin. Some people get a little bit of asymmetry or a little bit of a pulled effect, but they are usually temporary and they heal within 3 to 4 weeks. But as I said before, most of my patients can return to work within 7, at the most 10 days.